Hi, my name is Kristen Grennan. I'm Director of Strategic Communications for the Mayor's Public Engagement Unit. I'll be your MC for today. First, I would really like to welcome from the Public Engagement Unit's Get Covered NYC team. We have two specialists, Tanya Navarez and Orville Berry.
Hi, good morning. My name is Tanya, and I'm a specialist with Get Covered NYC from the Public Engagement Unit. Welcome this morning to this event. Hopefully, we'll provide all the resources you need for healthcare as well. So, Get Covered NYC is a city-wide outreach program from the mayor's office, and we provide free assistance for New Yorkers seeking to enroll in health insurance, regardless their income or immigration status. We walk everybody from from the first step to the last step from the enrollment, so people can be comfortable approaching us to get enrolled with healthcare. So the most important thing about getting a healthcare is that a lot of people are not aware that even though that they reside in the city for years, they are eligible to receive healthcare regardless, like I said, their income or immigration status, either by health insurance, or NYC care. So why is important to have health insurance? Because you prevent a lot of, it's preventive for you. It avoids a lot of visits for them to the emergency room, and also provides stability in your life knowing that you are covered. So this month, this is the health minority mental health month. Please prioritize your health, get enrolled, find information about health insurance. We'll be here all morning to provide this assistance. And remember, if you need to get in touch with Get Covered NYC, either you can call 311 or you can go online to the Get Covered NYC slash get nyc.gov slash get cover nyc, and we have different languages available for everybody. Our unit is very diverse, so you don't have to be scared that if you don't speak the language, we will provide that. If you don't speak English, that you don't have access. Yes, you will have access regardless of your language. I'll say this in Spanish. Recuerde que para registrarse con el seguro médico o el programa de asistencia puede acercarse hoy vamos a estar aquí en la mañana dando la información, o puede llamar al 311. También puede visitar la página de la ciudad de Nueva York, que es nyc.gov, Get Covered NYC. Gracias.
Good morning again. Can everyone hear me? Wonderful, wonderful, because I had a big breakfast this morning, so I'm ready to go. My name is Orville, and I'm a public health educator and a Get Covered NYC specialist. We're here today to kick off National Minority Health Month with our Bronx community partners. Thank you to all of our partners here today. Please give yourself a big round of applause. I see Metro Plus, BronxNet, Bronx Documentary, Red Pueblos, Bridge Builders, Assembly Speaker, NYC Care, and Destination. The theme for this year's National Public Health Week is centering and celebrating cultures in health. We cannot celebrate the incredible culture of the Boogie Down Bronx without addressing the health disparities in our community first. Our Bronx community face the highest rates of issues, including diabetes, health disease, obesity, asthma, HIV, AIDS, cancer, and many more. The Bronx is labeled hashtag 62. Do anyone know what that means? Hashtag 62 means the Bronx is last in every category I just mentioned of the 62 counties in New York State. And that's why we're here today. with more than a dozen of our community partners sharing resources and encouraging everyone to get covered. Today, we're going to attack hashtag 62. We are going to provide you with the knowledge, the education, and the resources so that you can make an educated decision to improve your lives. At GetCoveredNYC, we combine our community outwork with in-depth case management, helping New Yorkers to live healthy lives. At this time, I want to share with you a personal story of how effective our work has been. 2 years ago, well, this was prior to the pandemic, I was at an event similar to this. And I was able to enroll a young woman. It was not until after the pandemic, when I was at North Central Bronx, again doing my outreach, a lady beckoned to me and said, Mr. Berry. I went over to her, but I did not recognize her, and I apologize for that. She said to me, do you remember me? I said, no. She said it was at an event that I met her and got her enrolled with health insurance. She said with that health insurance, she was able to do an annual physical exam and discovered that she had cancer. She said that was the reason why she was at North Central Bronx, because she was following up on treatment regarding her cancer. What I did, she equated to saving her life, because she was walking around not knowing that she was diagnosed with cancer. These are moments that are special to me, and that's why I'm excited to be here today with the Bronx community. Someone here today at this health fair might be the next Winsome. Someone here today may get enrolled in health insurance and may get access to preventive care. Someone here today may get a health screening that could save their lives. Someone here today might learn about resources available in their community from one of our partners and get the help, the trust, and need to retain their health. Thank you very much.
Thank you so much, Orville and Tanya. I would like next to welcome Teresa Daughtry from the NYC Cares Office, Director of Community Affairs. Thank you, Teresa.
Buenos días. Mi nombre es Teresa Daughtry y yo estoy con NYC Care, un programa de New York City Health and Hospitals, el sistema de hospitales públicos aquí en Nueva York. Sentimos honorados de estar aquí con todos porque abril es el mes nacional de la salud de las minorías y también el lunes vamos a comenzar la Semana Nacional de la Salud Pública. Eso es muy importante porque en Nueva York la atención médica es un derecho humano y NYC Health and Hospitals atiende a todos los neoyorquinos por todo el año, cualquiera que sea su estatus migratorio o su capacidad de pago. Los miembros de NYC Care reciben una tarjeta de membresía y una línea directa de 24 horas los 7 días de semana y acceso de atención primaria y especializada. Tenemos aquí hoy 3 organizaciones comunitarias que pueden conectarlo, a toda la información y recursos que necesitan para estar parte de NYC Care. O, si quiere obtener más información, por favor, visítanos en nuestro sitio web nyccare.nyc o llame al 646-692-2273. Good morning, everyone. I'm Teresa Daughtry, Director of Community Affairs for NYC Care, And we are so proud and honored to be here as part of New York City Health and Hospitals, which is New York City's public health hospital system, the largest system in the country. And we are especially proud to be here because April is National Minority Health Month. And of course, Monday begins National Public Health Week. This is especially important in New York City because here, healthcare is a human right. And New York City Health and Hospitals is committed to serving all New Yorkers, regardless of your immigration status or your ability to pay. Today, we have 3 NYC Care community partners, Korean Community Services, Arab American Family Support Center, and of course, the Bronx's own Sauti Yetu, who will be joining us shortly. And they're here to help share information and actually start enrolling people in NYC Care. We are very grateful to our hosts, La Central and YMCA, and all of our community partners, especially BronxNet, Metro Plus, Lincoln Hospital, and the Public Engagement Unit. We're so grateful to be here, and we're so proud to continue serving the Bronx and all New Yorkers. Thank you. And now, as I mentioned, the Bronx's own Sauti Yetu.
Good morning, all. I'm going to start in French. Bonjour tout le monde. Je m'appelle Tigidanke Keita. Je suis le case worker à Satietu, Center for African Women and Family. Satietu est l'organisation qui aide les immigrants à avoir l'assurance médicale, especially NYC Care. NYC Care est ici pour les gens qui n'ont pas de papier. Et si tu n'as pas de papier, tu ne peux pas avoir d'autres assurances médicales. Et NYC Care est là pour nous aider à aller voir nos docteurs et avoir nos médicaments pratiquement gratuits. Avec NYC Care, vous pouvez aller dans n'importe quel hôpital dans New York que vous voulez. Et l'hôpital, c'est complètement gratuit. Et on a vu aussi que nos parents sont là, qui sont malades et qui n'ont pas d'assurance médicale. Et avec NYC Care, vous pouvez avoir l'assurance pour aller voir votre docteur. Good morning, all. My name is Keita Tigidanke. I'm a caseworker at Satietu, Center for African Women and Family. Satietu has been part of NYC Care for the past 3 years now. We encourage our community members to enroll to NYC Care. NYC Care has been such a great program for the immigrant people, especially those that don't have any immigrant status. We've seen that our community members, many of our community members doesn't have any health insurance due to the lack of their immigration status. NYC Care is here for you to help you enroll into it and get insurance for 1 year that is renewable. With NYC Care, you got to see any doctor of your choice. As long as you live in New York City, the 5 boroughs of New York City, you can also have most of your prescriptions for free. So we encourage our community members to enroll into NYC Care and take care of your good health. Thank you so much for having us. Have a good day.
Thank you so much. Sauti Yetu is just one of dozens of partners here today, as well as Assemblymember Septimo's office is over there as well. And as a reminder today, you can get your immunizations here for COVID, as well as flu. And then we also are doing health screenings, so you can get free health services today right here. Additionally, you can speak to Get Covered or NYC Care for coverage for health insurance, regardless of your immigration status or ability to pay. And we also, the YMCA is open and free today. As you can hear, there's a basketball game going on. We'll have capoeira and yoga, as well as Zumba. And you can also hit the pool and sauna. So this is really about your health and wellness in honor of Minority Health Month. Outside, we also have vans, and I just wanted to highlight that right now there is a blood emergency in New York City. And the New York Blood Center is outside taking blood now, today. And there'll be, if you give blood today, you're entered for a sweepstakes of $250 gift card. For all who give blood today, you'll be entered. So please, if you are able to give blood today, please do. With that, I would like to welcome Michael Max Knob, the Executive Director of BronxNet, our partner for today.
Thank you, Kristen, and your great team from the Public Engagement Unit. I'm Michael Max Nobby, the Executive Director of your multimedia public service network, BronxNet Television with an educational mission. We promote participatory media, experiential learning, and more, as well as producing award-winning local programming from the Bronx to the universe. And we at BronxNet are proud to partner with the Mayor's Public Engagement Unit, NYC Care, Get Covered, Health and Hospitals, and all of the partners in the healthcare fair at the beautiful Bronx YMCA at La Centrale in the South Bronx. Isn't this facility magnificent? I was looking at the pool and the weights and the strength training classes, the yoga classes, capoeira, started participating, and you know what? I joined this morning. I don't know, I'm excited. My fitness goals are gonna be met in 2023, I think. So today, please check out our BronxNet pop-up studios. So we've got a pop-up studio when you enter with Dr. Bob Lee speaking to community leaders. We've built a multimedia interactive pop-up studio for you, for the community, to share your stories and vision about the Bronx and the transformation that we are seeing together. Because you, our community, we together are a part of positive transformation. So right downstairs, we built a multimedia chariot for you to interview your neighbors, for you to host your own TV segment from the Bronx to the world on BronxNet. Also, right here is a virtual reality immersive media experience with Will Roberts, who is an artist at BronxNet, an artist in residence at BronxNet. He's teaching media arts classes at BronxNet, as well as creating new original immersive media content on BronxNet that you can interact with, and you can try it today in this pop-up studio thanks to Creatives Rebuild New York. And I've got to say that I'm so excited that we are here with this pop-up activity for you to participate in media, but we are going to be right across the street with the brand new BronxNet Media and Technology Studios at La Centrale in the hub in the South Bronx, with media education classes, immersive media studios, a windows on the South Bronx studio, and more. Because again, we're promoting digital equity, we're working towards health equity together, we're making our communities stronger, and right now I'm going to introduce to you the original MC, the 21st century Vitruvian man, a pioneer of hip hop as we celebrate a half century of hip hop together. He's the host of Grandmaster Fitness on BronxNet and the Grandmaster Hip Hop Invitational. Please put your hands together for Grandmaster Melly Mel, the man with the message.
Give a big hand to Michael Max and Avi. Give a big hand to the Max man. That's the boss right there. How's everybody doing today? How's everybody doing? Everybody good? We good? We good? Everybody good? We good? Oh, yeah. Mike told me about the health fair like last week. He wanted me to come by and just say a few words to the people. And me, myself, I've been working out. I'm 61 right now. And so I'm 61 right now, but I started working out in the gym since I was 24. And the importance to me of working out, it's twofold. But let me just say this before I say it. I have 3 gym memberships. I work out at Extreme Fitness in Mount Vernon. I got a 24-hour fitness membership. I can work out at anyone in the country. And I got a Planet Fitness membership. Now, the reason why working out for me is so important is because 61 years ago, the great Lord up above gave me something that I consider is so important and special to me that I'm going to hold on to my very last breath because I appreciate what the Lord has done for me. And that's why it's important to me. Now, health for anybody, it should be important because as long as you're here, you're there. You know what I mean? Don't get caught up in the whole social media, the whole thing of what everybody's doing with their life. Your health is your personal sacrifice and your vision of who you want to be, and for every day to get up to be a better and more positive you. That's what it's all about. Even those kids playing basketball over there right now, it's just a game, but so is life. So it all is relative. Me being a young man, I mean, I never could play basketball, but I was always active. And me getting older, when I got into my 40s and my 50s, always seen the need to stay active and be active, because I always wanted to feel inside, even though I had to grow up and have responsibilities, have to take care of bills, work, have kids, but I always wanted to feel young and youthful inside, like I was still a young kid. And to this day, I could still channel in my inner kid, to be youthful, to laugh at things, and that's another thing about being healthy. And I tell people all the time, happiness is about as healthy as you're ever going to get. So, in other words, you can't waste all your time working out and eating wheatgrass and not enjoying life and expect to actually be healthy. If you look at the people that eat the healthiest, they not necessarily the best looking people, because you're not happy. You see what I'm saying? Me, and out of all that I've been through in my career, I've had a great career. I'm a blessed human being, but everything wasn't a great ride. I had a lot of tribulations, but you know what? I love that, because you got to get up the next day and you still got to work towards something. And no matter what it is, even if you got to get up and walk, even throughout the pandemic when they closed all the gyms, and for me, not being able to go to the gym, that's like the end of the world. But you know what I did? I ordered a pull-up bar, came 3 days after the pandemic, and I walked. I had a mask on, I had the gloves on, and I would walk I'd walk all through the Bronx for hours. But walking is the best exercise. So now for people to say that, I don't have time to exercise, my question to you is, can you walk? Can you walk? Then you can exercise. There you go. Best exercise in the world. And don't beat treadmill walking, but if you do enough walking in a day, you can maintain a certain amount of health. Water, hydration, walking, and just having a good mental outlook. It's like a lot of that's going on right now. Like people talk about mental health, right? Your mental health has 100% to do with your physical health. It's all one and the same. And as a matter of fact, when you work out, it kind of balances out your brain chemistry, your endorphins, or whatever they say it is. Whatever they say it is. But it balances it out, and it gives you a better attitude towards yourself, about yourself. Because that's mainly what being healthy is. It's being a healthier you. It's just like any women out here that got kids. Now, you cannot necessarily have to work out or not. But if you want to stay healthy for your kids, not only when they little, but even when they big, because your kids are always going to need you. They might say otherwise. They're always going to need you. But you have to be there. You have to be physically there in order to be there. Once you leave, everything else is spiritual. Yeah, my mother, she taught me this. My mother, she taught me that. But you have to be there. And that's my whole thing. Like I said, and at 61 years of age, I go in the gym all the time. And the main gym I go to is a 24-hour gym. So 2 o'clock in the morning, 3 o'clock in the morning, 1 o'clock in the morning, it don't matter. If the gym is going to be there, I'm going to be there. But when I get there, most of the people that's in the gym, they're more than half my age. And they might be stronger than me, but when they see what I'm doing as far as with my workout, they understand that I studied what it is that I'm doing. Because see, health is not a given. And there's a lot of different variants over, even life. Nothing is promised to you. I could walk out this door right now and get hit by a bus. But you know what? I was healthy before I got hit. See, that was a joke. But my point is, none of it is given, so you always have to cherish each and every second. I tell people all the time, when I breathe, I'm never on the end of my breath. I always breathe deep, like how when you're upset and they say, take a deep breath, take a deep breath. And then if you do take a deep breath, you'll feel a lot better because you're breathing in more air. Most people out there, y'all are at the end, you're on the edge of your seat and you're at the end of your breath. So you're not, you have to breathe. Like if you take it's the Lord's air, it what sustained us all. If everybody could just breathe just one time, if everybody could just take a deep breath, just a deep breath one time. Nice deep breath. Inhale and exhale, and everything gets a little better. So I don't want to, because I could talk all day about health. But the main thing is this. If you love yourself, if you love your family, then that's inspiration enough as it is. So whatever events that you guys are going to be doing, because Mike is my dude, he told me to come talk to the people. Obviously, I'm in the health. I'm more than happy to come talk to people about that. I'm more than happy to help people work out. I got a show, Grandmaster Fitness, on BronxNet. And I'd like to thank each and every person that's here, because at the end of the day, when you wake up tomorrow, I want you to be a better version of yourself. Thank you, and I love you all.
Thank you so much, Grandmaster. So I just want to remind you, this year's theme for my National Minority Health Month is focusing on health outcomes for racial and ethnic minority communities by providing them with culturally and linguistically competent healthcare services, information, and resources. The Public Engagement Unit GetCoveredNYC office provides free health insurance enrollment. We also have NYC Care available for those who are undocumented, cannot afford health insurance, or for whatever reason cannot get access to traditional health insurance. We also have workshops happening here right now for New Yorkers to learn about health resources, including nutrition and other information. We have free gym access, as well as Zumba, capoeira, and yoga, pool access, and much, much more. The community is welcome today. The total gym is free at the YMCA La Centrale in the South Bronx. We thank you so much to all of our partners. We have more than 20 partners here today providing free health resources to all New Yorkers. We also have translators available in more than 10 languages, and we welcome everybody, including indigenous languages, and we have community media and health resources available. And with that, I would like to say thank you so much to everyone who attended, and I hope you have a great day and really enjoy and take back your health and really feel empowered to take control of your health.